Hi, this is Dr. Nina Naidu, and I'm going to go through some frequently asked questions about breast lift surgery. So what happens during a breast lift? A breast lift is a surgical operation in which we're making cuts on the breast, we're taking out the extra skin, and then elevating the breast tissue on the chest wall. The size of the nipple-areolar complex is also reduced, and then it's centered on the breast mound. This is technically very similar to breast reduction surgery, except that we're not taking out any breast tissue. We're only taking out the skin. What types of incisions are used during a breast lift? There are three main incisions that we can use. The first is the traditional WISE pattern, in which you'll have an inverted T or anchor type of scar on the breast. So the scars will be around the nipple, straight down on the breast, and then underneath the breast in the breast crease. The vertical incision, which is what I use on 90 to 95% of my patients, uses an incision around the nipple-areolar complex and then down vertically on the breast. And then finally, in the periareolar incision, there's just an incision around the nipple-areolar complex, and that goes around the pigmented part of the areola. Frankly, very few patients are good candidates for this type of incision. In general, if you are moving the breast up by only a centimeter, then you're a good candidate. For pretty much everyone else, a vertical incision or an inverted WISE pattern incision is much better. Can I get a breast lift without implants if I like my size? Yes, absolutely. If you like the way your breasts look in a bra, then you're a really good candidate for a breast lift without implants. Just keep in mind that the look of the breast will be different with each one. So if you've lost weight or you've breastfed, you're going to notice less volume in the upper part of your breasts. If we put in an implant at the same time as your breast lift, it'll fill up that space and it'll give you a more rounded look. Without an implant, the profile of your breast will have more of a gentle slope. They're both really good options, and it really depends on what aesthetic result you're going for. How can I fix uneven breasts without implants? So the best treatment for breast asymmetry really depends upon your specific anatomy and how asymmetric you are. There are a couple of options. We can do a reduction of one breast and a breast lift of the other breast. We can do a breast lift on one side alone. If you have a very small volume difference, we can use fat grafting in just selected cases. And in some cases, a breast implant is really going to give you the most predictable result. But it's really your call. If you absolutely don't want an implant, just let your surgeon know. Will my breast lift scars fade? In general, yes, but everybody's different and scars will fade at different rates depending upon your skin tone and the quality of your skin. So the key to really producing good scars starts with your plastic surgeon. We need to do a really good wound closure, and this will reduce the tension on the incision. Scar creams do actually work, but you have to use them. Compliance is key. And the ingredients are important as well. Silicone has traditionally been a really important ingredient in a lot of medical grade scar creams and gels. And massaging the scar also seems to help break down the scar tissue as well. I do use an alternative scar balm in my office, which I created, and it contains rosehip seed oil, sea buckthorn seed oil, and Centella asiatica. I found that a lot of patients were reacting to the medical grade scar cream, so I created one of my own that has been working quite well. How much pain will I have after surgery? Most patients who are undergoing a breast lift don't really have that much pain. It feels almost like a cut on the breast. So they'll have mild pain, which will last for about 24 to 48 hours after surgery. If you have severe pain or sudden swelling, that can indicate bleeding, in which case you'll want to call your surgeon right away. Pain medication can be either an anti-inflammatory medication versus a narcotic. For all of my patients, I prescribe anti-inflammatory medication. Narcotics are really not necessary after this type of surgery. I do recommend that patients limit their activity, and you should always follow your surgeon's recommendations in this level. How long does a breast lift last? Again, this is going to depend on your skin quality and your weight and how well you maintain both of those. So it varies a lot from patient to patient. Significant weight loss is going to result in a significant drop of the breast. So I always tell patients, if you are planning to lose weight, get to a stable weight, get to your goal weight before you do your breast lift surgery. Skin with compromised elasticity won't hold as well over time. And by compromised elasticity, I mean skin that's really lost its stretch. So for example, a patient who's gone through massive weight loss, they typically have lost a lot of stretch in their breasts. Another example would be a patient who has had several children and who has breastfed all of them. Again, the stretch of the tissues is really lost, so their skin doesn't hold up as well over time. However, that being said, most patients will notice a drop of 1 centimeter or less over time. Will a breast lift impact my nipple sensation? It shouldn't. No, we're not cutting the nerves to the nipple during this type of surgery, so you should have all of your sensation. We do make incisions around the areola, which is a pigmented area around the nipple, so you might have some temporary numbness in this location as those tiny nerves have been cut, but they will regenerate. So typically within weeks to months, you should have normal sensation. So that's it. For more information, please visit my website, naiduplasticsurgery.com, or you can give us a call at the office at 212-452-1230.